Human being is a non-stop message that amidst ideas, feelings, option views, calls, etc. This machine requires electric current, intelligence to go on. What is raw material consumed? It has 5 elements which are required in certain knowledge. There are 5 sensory organs: information, experience and data accepted machine called human beings, the 5 events. The 2 important indexes of all its hearing and vision. Hearing impairment is an inability to hear completely and as adequately as a normal person. Since those signals 24 into 7 into 365, they take hearing as granted. Hearing is most important part for all human beings. People aware of sounds and signals which ensure our security and safety provide constantly information among the surroundings. These people artistic satisfaction and pleasure helps people acquire knowledge, keeps people updated with each other. People cannot think about life without hearing. It is so much important and part and parcel of living. Hearing is an automatic process which can be done in the area of activities simultaneously. This doesn't mean that who are not able to hear cannot pretense mention, so mind your intuition. Persons with hearing impairment can do all but little differently. We must understand a few points to understand hearing impairment clearly. First and foremost, one should understand that the majority of people have a hearing impairment. It means its functioning level may vary from each other. Hearing impairment is a condition resulting from its structural abnormality, like a hole in eardrum, and may or may not produce functional disability. Impairment is a physical, biological loss of an organ. You can considerable not having one arm or a boy having hearing loss. According to World Health Organization (WHO), there is a restriction or lack of ability to perform an activity in a manner or within the game that consider knowledge for human being. Handicap is defined as a limitation or loss of opportunities to take part in the life of the community unequal level with others. Did you notice hearing impairment is a small beginning which is not treated at an earlier stage leads to disability? It is a major concern. But then disability is not intervened at earlier stages, then it will not notice as a handicap. We need to have a society which is barrier-free and inclusive if you want impairment turned into handicap. Such society needs to equal protection of rights of persons with disabilities and opportunities. Hearing impairment means loss of 60 decibels or more in the better ear in the conversational range of frequencies. According to Census of India, hearing impairment means all those who cannot hear at all, can hear only loud sounds, cannot hear through one or other ear is functioning normally. An individual can hear using hearing aid will not be considerable as disabled under this category. If you are aware about the mentioned terms, then you will understand the need for early and immediate intervention. You should know that the families accept hearing loss at the earliest so that much time is not wasted and blamed. Doctor shopping of feeling of guilt. Immediate action should be taken and it should be diagnosed. You must educate the parents that hearing impairment cannot be prevented, but handicap can be prevented. Children with hearing loss are neither speechless or dumb. The term hearing impairment refers hearing loss of all the degrees from mild to moderate. It indicates the biological status of the hearing mechanism. The word deaf is used to refer to individuals who have profound more hearing loss. Deafness indicates the individual has profound cognitive irreversible hearing loss. Any children with hearing loss come across from this category. Many adults with hearing loss prefer to be called as deaf. Since the address avoids words like handicap, impairment, loss, etc. A term with negative connotations, you should use this term, refers physical and biological hearing impairment has severe and negative impact to the functioning of that individual and development. More than loss, it indicated limitations, restrictions, and incomplete participation. After looking the various definitions, one may think that hearing loss is not same for all. What it means for an individual differ person to person. Describing hearing loss, it is generally considered into two attributes. You have to meet the child with hearing impairment in general. They are capable of doing everything, those non-impaired children. But what each child does, the range of reality of various factors. It is hard to predict what an individual with hearing impairment can do and cannot do. Hearing impairment can be by birth acquired, postlingually acquired, bilingually, or due to aging. Hearing impairment can be either in 1 year or in both the years too. It can be of various degrees like mild, severe, moderate, and profound. Hearing impairment can be permanent or it can be temporary. It can coexist with other disabilities of medical concerns. Hearing impairment can be reversible or can also be irreversible. What a child can do and cannot do depends on the above factors. Treatment also depends on various factors. These factors are related to the environment of the child equally or even more important. The factors are whether the child got communication access with an instrument through hearing aids or language signs, whether the child got access to communication at an earlier stage or not, whether the hearing aid benefits the child or not, whether the child has family support or not, whether the child got admission into an appropriate school or not. The above examples are just a few for overall understanding. Many more clinical factors are arrived to find out the functioning level of a particular child. The population of individual with hearing impairment becomes heterogeneous due to these complex interactions among the large number of factors, and intervention becomes unpredictable. You have to assume a particular level of functioning and dealing with students with hearing impairment. If you are aware of this heterogeneity, this will guide you to prepare case profile of each student separately. Heterogeneity knowledge will help you involving over or underestimation of the student's performance. According to NSSO 2002 report, more than 3 million children under age of 6, that is about 0.2% of the population, have hearing impairment. You might wonder which profound diagnosed during loss. The paramedical professional audiologists are expected to do it. This can also be done in public and private hospitals having ENT specialists. There are various types and degrees of hearing loss. You're already known about the types and degrees consist of two primary little minors of the functioning level of an individual. Therefore, it is necessary to know about the degree and type of hearing loss before educational, facilitative or the educational plans are made. There are various modern trained technically advanced tools and instruments used to measure hearing loss. They are objective and subjective types. The most common method used today is conventional procedure is pure tone audiometry. In this test, the affected individual will be asked to analyze each and every sound released by the analyst. These sounds consist of intensities and varying frequencies. The response will be plotted on a graph which is called as an audiogram. This is the first step towards the intervention of a child. This will guide you about a particular individual can hear and what the child cannot hear. On the future, questions will be answered to be two questions. An audiogram is most important document for an audiologist and speech therapist. It helps the child in various reasons. In planning educational objectives, by guiding parents about communication option which could work better for the children. Helps family to select the school. Helps parent to plan home auditory and simulation training. Hearing loss is of two types depending on their part of the auditory system is damaged. Therefore, to understand the types, we have to understand the parts of the auditory system first. The auditory system consists of the auditory nerve and the ear connecting the cortex in the brain. The ear consists of three parts. They are outer ear or external ear, the ear canal and pinna, middle ear. It consists of three small bones called ossicles and eardrum. It consists of semicircular canals and cochlea. The auditory nerve transmits information from the ear to the brain. The sound is transmitted from the ear to the middle ear and then to the inner ear. The inner ear then takes the information to the brain through the auditory nerve. Any damage in this part may lead to hearing loss. This happens when sound is not conducted efficiently through the middle or inner ear. This means conditions whereby there are any problems in the ear canal. For example, wax or foreign body in the ear or any problem in the middle ear. For example, hole in the eardrum. This visually involves a reduction in sound level. This type of hearing can be treated medically or surgically. This occurs when there is damage to the cochlea, that is inner ear or the artery nerve cannot be medically or surgically treated. It is a permanent loss. This not only an opaque to sound level or ability to hear take sounds, but also affects speech understanding or ability to hear clearly. Sometimes a conductive hearing loss occurs in combination with sensory neural hearing loss. In other words, they may be damaged in the middle of the ear and in the inner ear or auditory nerve. When this occurs, this hearing loss is called mixed hearing loss. This is the most important factor to be considered while describing hearing loss. It's not just place of damage, but the extent of damage. The test that commonly used to find out the extent of hearing loss is pure tone audiometry. This gives an average hearing threshold in decibel, which is called as pure tone average (PTA). Hearing threshold means a softest level at which the sound is heard. Hearing impairment is measured in dB, decibels. Hearing level, hearing loss. Normally, conversation in between 45 to 55 dB. A baby crying is around 60 dB. A traffic noise can be around 90 dB. A hearing is normal or near normal if you hear the sound between 0 to 60 dB. If you are not able to hear the sounds and that level and only hear sounds above 25 decibels, hearing loss, you have the hearing loss. This can be differentiated into various degrees depending on the severity of hearing loss. It ranges from mild to perform. Degrees of hearing loss, PTA, decibels, dB, normal 0 to 25, mild 26 to 40, moderate 41 to 55, moderately severe 56 to 70, severe 71 to 90, profound 91 plus. This means that the degrees of the configuration of hearing loss are the same in each ear. Asymmetrical loss is one which the degree and configuration of loss is different from each other. This hearing loss becomes increasingly worse with time. This one is bad as an acute or rapid hearing loss on certain people. Therefore, it occurs quickly. It requires immediate medical treatment to determine its causes. Some hearing loss gets better and sometimes worse, which is known as fluctuating hearing loss. This may be due to middle ear fluid or infection. This hearing loss is present at birth. It may be hereditary or developed during pregnancy or at the time of birth. Identification of hearing loss is a wide term. It includes various steps and more identification is used to indicate any one of these or all those steps taken together. These steps are: family members suspect speech problem or hearing loss in child. The family doctor or general probationer like a school teacher or an ENT observes, which allow endorse suspicion of the parents. They suggest further assessment. An audiologist carry an audiological assessment and diagnose the child for a hearing loss. A counselor explains the meaning of the carried out test to the parents. The report will be submitted to the parents. The child will be given the certificate of disability for hearing loss. It is very difficult to notice the hearing loss in a child when it is of mild stage, temporary in nature, unilateral in nature, present in the child born in a family with known history of deafness, fluctuating in nature, progressive in nature. The child of effects should be taken to the audiologist immediately without any hesitation, expected to identify the child having hearing loss. Delaying the assessment is not good. In both cases, whether the child has any loss or does not have, it is better to check the earliest. Ideally, screening to rule out of disability is the birthright of every child. Hence, Even if the child does not have the good hearing loss, it's a good step to take the basic knowledge of audiological assessment done. Hearing loss can occur to anyone at any stage. Hence, periodic ruling out of hearing loss at ease for school-going children is quite useful. All children who are going to audiologist are not found to have hearing loss. This time, the member suspecting hearing loss. How identify hearing loss in children? This can be categorized into two groups: young children under age 4 and school-going children. The method used for the first group is to compare the development of the particular child with the standard development chart of non-impaired children. The children are found to be late in achieving developmental milestone and then easily candidate should go for further assessment. Some typical signs of symptoms keep in mind. In the second group, if any child has one of these, then he or she has to be sent for further assessment. For the second group of school-age children, he must suspect hearing loss when the child has a strange, different and unclear speech. The child will have concentration and attention problem in class. The child appears to be isolated and lonely away from group activities. The child brings 1 year ahead while listening. The child speaks too loud of speech. The child does not respond to any question asked them behind. The child keeps TV, radio on high volume. The child will not respond to question asked from a distance. The child is not responding to his name when a question asked from another room. Even if a particular child has any one of the above symptoms, then he or she needs further assessment. Children with severe, profound of hearing loss are generally identified before the age of 5 or 6 years, particularly because of the noticeable impact of hearing loss under development of speech and language. Moreover, the absence of child responses to the environmental sounds and taking of others to clear indicators for the family members. The highest prevalence of hearing loss in the developing world is due to a variety of factors, including lack of widespread comprehensive immunization programs and under medical care. International organization, government and non-governmental organization have many opportunities to prevent and treat hearing loss through cost-effective means. Early identification of hearing loss is only the beginning for families with the intents with a hearing loss. Participation in a quality early intervention loss is identified and is next important step. For many families, however, finding a good program is not easy and families can be perplexed about what components make the program effective. Misconceptions among probationers and policymakers can hinder the progress that the children and families should expect if provided. Effective early intervention services. The knowledge about early identification and early intervention includes: early identification and early intervention may be detrimental to the family and the child. Early quality intervention promotes age-appropriate communications and language growth in many children. Children benefit from early identification and effective early intervention regardless of their individual differences. Early intervention services must be flexible to meet individual situations, respond to changes in family priorities, and response to those families find most helpful. No single communication approach works for all children.